Before the baby's born, what can a new mom do to prepare for when they bring the baby home?
Okay, that's a great question. Thanks for asking it. I like to tell parents, and especially when I get to meet with them before the baby's born, that one of the best things they can do is prepare for when the baby comes, and specifically with making feeding decisions in advance. The most important job that your baby has for the first year of life is to grow. And the way that the baby grows is by you feeding. And so this is really, other than just bonding with your child in the first year, your major job is to feed the baby. So I always ask my parents to come up with a feeding plan and then be prepared that it might change.
Okay. And so I know back when I had my babies that I wanted to be very dedicated to breastfeeding, because they always say breast is best, breast milk is the best thing you can give them. But you know, you always hear of moms saying, okay, well, I did it for 3 months, I did it for 6 months, but babies, the main source of food for the first year is either breast milk or formula. So how much research should someone who's planning on breastfeeding still do on formula feeding?
That's another great question. You know, I like to use myself as an example for this. As a pediatrician, I know that breast is best, and so my intention was to exclusively breastfeed my son for the first 6 months. But an emergency C-section didn't make that a possibility. I ended up having to supplement with formula in the nursery. Now, as a pediatrician, I know that formula feeding is a great second option. And so when they ask if I could supplement with formula, I was very comfortable saying yes. But a lot of parents aren't. And what happens is it's great, I want them to breastfeed, but they don't even entertain the possibility that maybe they won't be able to, or maybe in my case, I just had to supplement with formula. So that's why I always tell parents, if you're going to breastfeed, great, but still understand the basics of formula feeding, because there's always a chance that you might have to. And in reality, 2 out of 3 moms bottle feed in the first year of life at some point.
Okay. And when looking for a supplement, what should they be looking for?
When looking for a supplement?
Yeah, like a formula to supplement breastfeeding.
Oh, okay.
Maybe they're at the point where they're 6 months or 9 months in and they need to switch over. They're not making as much.
Right, the milk supply might be, yes.
You need to supplement with a bottle a day or 2 bottles a day or...
Well, you know what? Supplementing is always a good option, especially in the case if the mom's not producing enough milk. So even in the first couple, weeks of life, if a mom decides that she wants to supplement, that's fine. I try to get parents to hold off on that are breastfeeding until 4 to 6 weeks, because at that point the milk supply is well established and the feeding relationship is good. When it occurs later, as you were asking about, maybe at 6 months, it's a lot easier time to introduce a bottle to the baby, because it's getting towards the end of when they're going to be using bottles anyway.
Okay. What can a new mom do to make sure that our baby's getting enough milk, whether it be through breast milk or formula? How do you know that they're drinking enough?
So that is one of the most common questions that we get is, how do I know if my baby's getting enough? Now, if you're formula feeding, that's easy. You're using a bottle, so you know how much you're giving your baby. A newborn after the first day or 2 of life needs about 2 to 3 ounces every 2 to 3 hours. So if you're giving that, you can feel really confident that your baby's getting enough. You can also look at the number of wet diapers they're having every day. You want to see 8 to 10 wet diapers every day, and you want the urine to be a pale color, not at all dark like apple juice. Now, if you're breastfeeding, it's a little bit harder, but what mom wants to look for is that her breast feels softer after she's breastfed. That means the baby's getting enough. And lastly, you can discuss this with your doctor if you're concerned, and you can always look at the growth chart to see if your baby's getting enough. You want to see your baby growing on a smooth growth curve. So as long as the baby's growing, then I wouldn't have any concerns that the baby's, about the amount the baby's getting.
Okay, and a lot of new parents, they say they want to get their child on a sleep schedule, on a feeding schedule.
Yeah.
How important is that, or should you do that, should you not do that? And if you should, what point should you introduce that?
Okay, well, for a feeding schedule, I'll take that first. It's important to know, as much as we want to get our babies sleeping through the night in a sleep schedule and a feeding schedule, newborns should never sleep through the night. They need to be awakened 2 times a night. By 1 to 3 months, they start to get to where you can go to wake them up once to feed. And at 4 to 6 months, that's when you can expect your baby to start sleeping through the night. So what I tell parents to look for is when the baby is 12 pounds or greater than 4 months, that you can then hope that your baby will start sleeping through the night. One caveat to that is if your baby is older than 6 months and still not sleeping through the night, they might actually be waking up for comfort more than actually needing a feed. So the first thing to do is to stop that feed and try to, comfort your baby, but not introduce a bottle.
Okay. And at what point, some people say, oh, you've got such a chubby baby or a skinny baby. Does the baby know how much it needs? Will the baby let you know that it's hungry or that it's had enough? And should you be sticking to this is how many ounces for this age, or how do you figure it out?
Well, I think this is one of my favorite questions to answer, because if you get this right in infancy, you're going to set your child off on a path for healthy eating for their life. So I always try to explain to my parents that the best way to feed your baby is to be a responsive feeder. And what that means is you provide and your baby decides. So you want to follow the baby's inborn start and stop signals. So what that means is you feed your baby when your baby's hungry, even if you just fed them an hour ago, and then you stop when the baby's had enough. So let me just explain that a little bit more. Babies are really good at letting us know when they're hungry. So you want to start looking for feeding cues. Your baby might start to root, which is when they turn their face towards the breast or the bottle. They frequently start to make lip smacking or sucking noises. They might even put their hands in their mouth. So this tells you that your baby's getting ready to feed, and you really want to get to the point where you don't make them cry to feed. That's when you want to start feeding them, and you want to feed until they show you that they're done. And the way they do that is they become less interested in the feed. They slow down the pace that they're feeding. They might turn away from the breast or the bottle, put their hands in front of their mouth just to show you that they don't want any more, and really yawn and start to fall asleep. So all those things tell you your baby's done. So if you honor and follow these internal start and stop signals that your baby has, your baby will tend to overeat less, and that'll carry through to childhood. So it's really important.
Okay, and what about pacifier use at night? Instead of maybe doing a feed, a lot of people will give a pacifier, see if that works. Does that interfere with breastfeeding? What's your advice for new parents on that?
Well, using a pacifier is a very personal, decision. And some parents want to use pacifiers and others don't. I have a couple of guidelines that I give my families. One is don't be a pacifier pusher. There are some parents that just the minute, the baby opens their mouth, they pop a pacifier in. So you want your baby to develop their own self-soothing skills. So, don't always assume that you have to give them a pacifier. But on the other hand, certain babies just have they really want to suck a lot. And so you don't want to give them a bottle. So there's times to use a pacifier and there's times not.
Okay. And I saw that you have a most important tip for new moms. I was wondering what that might be.
So, the newborn period is such a wonderful time. And so I always, if I get the luxury of having the families come in before the baby's born, I say to them, just relax and do your homework ahead of time so that when the baby comes, you can just bond with your baby. This is really the most important thing that you can do, is get the hard work done, know your decisions, feel confident, and then relax and really enjoy your baby, because the time goes so fast. You just want to really enjoy it. And it's surprising, but most moms say that it's a blur. They look back and they can hardly remember it.
Because we're so tired.
Exactly.
So we've talked a lot about the babies, but I understand that you're a co-author on a new book about losing weight and feeling great for maybe moms. What can a new mom who's home from the hospital, it can be discouraging when you feel like you look just as pregnant when you get home as you did when you left. What can they do to get back on the right track?
Okay, well, I think the first thing to do is to get on a schedule. That helps moms feel more in control, feel like they're getting the hang of parenting. So once you're on a schedule, that opens up time to maybe get out and walk with the baby. So I think that's a great thing to do with a baby. That gets you exercise, it gets the baby out, and it's a good time to spend. So really getting into a routine and taking care of yourself, it's so important. Take the time, even if it's just resting, that helps you.
Thank you so much.
You're welcome.
Was so informative, and I feel like it's a lot of great advice for people who are just starting out on this journey.
Oh, thank you.